Hello, I am Michael House, and I am a faculty instructor with NAIOMT. And I look forward to talking with you in February. And what I am going to talk to you about are the conundrums that our families we serve face on a regular basis. And one of those main problems they face is that our kids are on our screens way too much. The Kaiser Family Foundation has a statistics that kids between the ages of 8 and 18 are on their screens for 7.5 hours on average every day. And that's just for the fun stuff. That's not even including the stuff that they have to do for school and for learning. And obviously that's a problem. And almost 1 out of 5 of our kids are at an unhealthy weight. And that is beyond taking into account of different cultures and different sized people. We are talking about a weight that leads to higher rates of diabetes and heart disease, and also perpetuates the problem of inactivity. One of our solutions to help our children grow up and to be healthy adults is that we encourage them to be in youth sports. And youth sports is way more than just about having an athletic skill and being on a winning team. Youth sports offers all kinds of important benefits that our kids can benefit from. But just like this stain that's on my shirt when I had this big streak here, I realized, and I tried to wash it out and it still doesn't look that great. Similarly, when we're trying to deal with these conundrums that these families we serve face, things can go too far the other direction, just like this stain on my shirt is now bigger than the original stain that I had. And that problem is within youth sports, that there is a stronger emphasis for our kids to specialize in youth sports way too early. And I say our kids, I'm talking about our kids as a society, because my wonderful kids in the background here, they're not very athletic and not that competitive. They are wonderful kids and they have many wonderful traits, but I never have to worry about them specializing in youth sports too early. But for those families that do come to you when you're treating their child for their knee pain or their ankle pain or their hip pain, is it really an acute injury, or is there some more nefarious problem going on because this child is playing one sport for more than 8 months of the year, or maybe even playing a couple sports constantly throughout the year, and they are not getting enough rest? And I think it's brilliant that as an American society, we have put more focus on dealing with concussion and concussion prevention and being aware of the consequences of concussion. Now my hope is that society will understand that these youth who choose to focus way too early on a single sport or playing the sports way too much may also have some detrimental effects. And so I hope you join me in February and we will discuss the conundrums that families face. And we'll talk about the statistics and the consequences of early youth sports specialization. And I hope there's a discussion. Maybe some people have a different point of view than and I look forward to hear that point of view. And then finally, I hope you'll leave with some resources and some points that you can bring to those families you serve so that you can help those children become consistently active throughout their entire life, and not just for a brief moment in time while their parents dream of their kids going off to be collegiate or professional athletes, when we know most do not. But we want our kids to be active, healthy people throughout their entire life. And so we'll talk in February. I'll see you then.